Dr. Nouf Behzad, she is a consultant OBGYN at Salmania Medical Complex. She is also a tutor at Arabian Gulf University and a member of the Medical Commission and the Ministry of Health. She received her MBBS from the King Faisal University and is Arab board certified. She completed her fellowship in urogynecology and pelvic reconstructive surgery. حياك دكتورة.
أهلا عائشة. Thank you for this nice brief introduction from my beloved student Aisha, and thank you for inviting me to be part of this meeting today. I hope that you can hear me properly. Can you hear me?
Yes, doctor.
So let me share my slides. I prepared a few slides to share with you, but actually I don't want it to be a formal presentation. I want it to be a talk from heart to heart, from a tutor to my students or to my future doctors. So I would like to share with you my experience in OBGYN department. I would like to talk to you about what is obstetrics and gynecology. But before that, I would like to ask you a question, answer it between yourself. How to choose your specialty? I think that was covered by Dr. Abdurrahman and the rest of the speakers earlier in the morning. But for me to choose your specialty, it's very important to be engaged in the clinical field. I love this subject as a medical student is different than I worked in it. If you want really to choose your specialty and not to regret later on, give it a chance in the internship. Internship is a year, which it is actually a mimicking year, which will put you in the field for the clinical experience. And if you did not get enough experience during the internship, try to do it as a clinical attachment before you decide going into this specialty. There are some misconceptions about OBGYN, and I don't think they are facts, but they are misconceptions in my opinion. Everybody thinks that it is a bloody field. It is a 24/7 working in labor ward. There are ladies who are screaming and men who are upset, and there's no social life. But actually, these are not facts. We live as gynecologists. Our life is different, and you can tailor your life the way you want. Of course, there will be sacrifice. بيكون في أشياء على حساب أشياء ثانية, but there is always a place for everything. So I'll talk to you briefly about training, a residency program in OBGYN department. In OBGYN specialty, as a general, you will have like 5 years training in Bahrain. It's a 5-year training program. The years may differ all around the world. Maybe it will be a little bit longer in Australia and in UK, but it could be shorter in other areas like in India. Depends on which degree you are going to get. So in Bahrain, we have a 5 years structured program. The first 2 years will be general. You will be spending your time mostly doing the basics in obstetrics and gynecology. You will spend lots of time in labor ward, doing deliveries, assisting or maybe doing cesarean sections, suturing episiotomies. You will be facing normal ladies who are delivering, or maybe sometimes high-risk patients. And of course, in the first 2 years, you will be exposed to the general gynecologic problems which the ladies might have. In the 3rd and 4th year of your program, or of the program, you will be going into subspecialties. You will be rotating in the subspecialties and the different subspecialties in OBGYN. It depends. You might find these subspecialties in your center, but sometimes you might leave your hospital or your center to do a couple of months rotation in your country or other countries to fulfill the criteria of completing the subspecialty years. And the 5th year will be just a sum up of everything, and you will be in your 5th year able to decide which subspecialty I would like to go to. By the 5th year, of course, you will be preparing for your exam, and by finishing your exam, you will be able to be a specialist in obstetrics and gynecology. طبعا in Bahrain we have the Saudi board and we have the Arab board until now. We don't know that in the future maybe we will recruit other boards, hopefully inshallah. Subspecialties in obstetrics and gynecology are broad. Obstetrics and gynecology is a broad specialty. We have main or major subspecialties which are known to everybody, which are the gynecologic oncology, and we have two great gynecologic oncology in our center. In gynecology oncology, you will be doing everything. That's why I'm saying great surgeons, because the gynecologic oncologists will be doing almost everything in surgery. And they will be, of course, engaged in managing the patient and choosing the protocols and the tumor board along with the medical oncologist. The second subspecialty, which is very famous to everybody, is reproductive medicine and infertility, and we have a lot of them. Very well-known names doing infertility and reproductive medicine. And the third subspecialty is urogynecology and pelvic reconstructive surgery. And طبعا شهادتي فيه مجروحة because I'm a urogynecologist. What I do is to give a better quality of life for the females who have urinary incontinence, urinary dysfunction, and pelvic organ prolapse. For those who are interested in pregnancy and taking care of pregnant ladies and their babies, it is good to choose to do a fetal medicine and or high-risk pregnancy. There are some other minor, we call them minor subspecialties or new subspecialties coming up, which is cosmetic gynecology, which is actually becoming a very promising subspecialty in obstetrics and gynecology. MIS or minimal invasive surgery, and actually minimal invasive surgery involving all the major subspecialties, but there are some people who want to do only laparoscopic surgeries or hysteroscopic surgeries. So that's why this minimal invasive surgery came up as a separate subspecialty now. Women health, sexology, which can be done by gynecologists or even family medicine, and pediatric or adolescent gynecology, which we don't have it as gynecologists in Bahrain. I don't know if the pediatrics have this subspecialty, but for us as an obstetrics and gynecology, unfortunately, we don't have pediatric and adolescent gynecology yet in Bahrain. And this is a good opportunity for someone who would like to specialize in this field. There are some people who finishes their board and will have like 2 to 3 years of experience somewhere, and they would like to just do a general gynecology and be a general obstetrics and gynecology consultant. Working in obs and gynae department, a resident has lots of challenges. فيها شوية تعب. It's a hard-working or heavy-duty department. Residents will work like 7 to 8 on-calls per month, and these on-calls should be in-house, in hospital, and actually in labor ward. You cannot stay just in your room and waiting for somebody to call you in case they need you. No, you have to be physically, mentally there, ready and prepared for any emergencies which can occur in the labor, which might occur in the labor ward, especially, and needs an immediate action. Your weekends or your after working hours are not yours, unfortunately. You might be called at any time to give help for the team who needs maybe they need help, they need an extra hand, somebody is absent for an emergency on call, and they need somebody, a substitute for this person after working hours or even in the weekends. As I said, it's a heavy duty, especially doing labor room on calls is really hectic. So you have to be there prepared physically and mentally all the time for any surprises. You should have, of course, a logbook to pass from year to year, recording all the surgeries and the procedures you have done, and you should work really, really hard so that you will not be forgotten in this department. What are the advantages and disadvantages? So if I would like to talk about محاسن الشيء أو مساوئ الشيء, actually this will help you to understand the workload in this department. It will help you to understand طبيعة العمل في الأوبسنغايني, but not to choose or not to choose. Choosing OBGYN or not choosing OBGYN, I would always recommend to work in it before you judge, I wanted to do this, I don't want to do this. So what are the advantages or disadvantages working as an obstetrician or as a gynecologist? So let us talk about the advantages. It's a broad specialty, as I said earlier. There are it's medical and surgical يجمع بين الباطنية ويجمع بين الsurgery. You can see inpatients, you can see outpatients, you can do minor procedures, you can go do major procedures in the OR. The labor room itself is something nice to work in labor room to deliver babies. So ما في مجال للملل. Honestly, in OBGYN department, you will really enjoy. Every day you will learn something. Every day you have a new thing to do. Every day you have challenges. So it's a broad specialty. If I don't want to be engaged in the OR the whole time, I can do something outside. Another advantage is the population you are treating. The majority of the population we are treating are healthy young ladies. Pregnancy is not a disease. Most of our patients, half of our patients are pregnant. This is a physiological changes which occurs in the body. Somebody is carrying a new life, bringing a new life, forming a new family. So the population we are dealing with in obstetrics, most of them are healthy population. So the outcome, and even actually in gynecology, for instance, a patient who is having uterine fibroid, she's a normal, healthy patient, but she's having a fibroid. Okay, we'll remove this fibroid and then she will continue her life happily, inshallah. So our population, the majority of our population are young and healthy ladies. So expectation will be good and will be nice. And the outcome most of the time will be good. The good outcome means a happy patient and a happy, satisfied doctor. And this is one of the advantages actually being an obstetrician or a gynecologist. The third advantage is opportunities. طبعا الcompetition is high to be accepted in obstetrics and gynecology لأن part of it is a surgical department. It's considered as a surgical department. So acceptance might be a little bit difficult وفيها a high competition. But when you are done with your board and you are a specialist or you are a consultant, you will find lots of opportunities, whether inside Bahrain or outside Bahrain, everywhere in the world, you will get an opportunity to work. فالopportunities are always there لأن obstetricians especially obstetricians are wanted everywhere. They are welcomed everywhere. And the thing which you cannot stop is deliveries and pregnancies. So this is an advantage. The other thing is for those who would like to make a relationship with a patient. What I mean by relationship is that you will be following a lady for 9 months. You will see her mom, you will see her husband. So you will be actually engaged with this family, and you will be part of this family actually. And this is something nice, and this is something this is an advantage. I consider it to some extent. From the disadvantages, is the lifestyle. What do I mean by lifestyle? Your life will be affected a little bit, especially in your first years, especially when you are a resident, because you have to work a lot. You might work after work in weekends. You might need to work after hours for long. You might need to stay with the patient after your duty just to make sure that she is fine and she's having a safe delivery or whatever. So especially your life will be affected during a little bit, will be affected during your residency, but it's never a zero lifestyle or zero social life. There will be of course a place for your social life, but you have to balance and always remember that you are a doctor. You might sacrifice a little bit of your time just to help people. The second disadvantage is, unfortunately, litigations. Why litigations are more in OB/GYN? Medical errors in general occurs everywhere in the world, in all the specialties. We cannot prevent medical errors. If we can prevent road traffic accidents, then only we will be able to prevent medical errors. We work hardly. We work hardly um, to deliver this patient safely or to do a surgery for this patient, but complications happens and mistakes happen. But why litigations are more with the gynecologist, and actually it's more with the obstetricians, uh, because of the population we are treating. As I said, our population, the majority of our population are young, healthy ladies. It makes difference when a member of a family is admitted to the ICU and he's very sick and he's, for example, intubated, he has lots of medical problems, than when a young lady coming to the hospital to deliver, to start her family, or to have a baby to add to her small family, and then she will end up with, for example, a fresh stillbirth or birth asphyxia, or unfortunately, rarely, maternal death. It makes difference. The reaction of the families will be different. Even for us as doctors, it's very difficult to accept maternal death of young ladies. That's why litigations are more. Acceptance of complications or errors in obstetrics basically is very hard and very difficult. That's why these patients, we have lots of litigations in obstetrics and gynecology. One more thing which I forgot actually to add it to the advantages, that obstetrics and gynecology is a fertile field for research and papers. So if you're going into this field, do not forget to report cases, to do researches, to do papers, and the data are widely available, and they are easily to be retrieved in obstetrics and gynecology. Actually, I reached the end of my presentation, or my talk, let us say to my talk. Taking home message: before thinking of going to obstetrics and gynecology, give it a try in your internship. Live as a resident, work clinically, involve yourself and engage yourself in the clinical field. If you couldn't do this in your internship, try to do it as a clinical attachment. Second advice, do publications, write case reports, be engaged in researches. This is very important nowadays, and it will be involved in the competition and the selection in your residency or even in the fellowship. And my last advice for you: respect your patients. Work from your heart for your patients, and do not forget your family. Do not forget your social life. Thank you very much for listening to me. And thank you very much of having me today as part of this career day. Thank you.
Thank you, Doctor, so much. Thank you. It was an honor to have you with us in the Career Day. Anyone has any questions, please, you can bring it up in the chat.
Anyway, if you have any question, I'm always there. All of you can approach me at any time. Thank you.
Thank you, Doctor. Thank you so much.